be one of the most challenging responsibilities of anyone's life, especially since there's no easy how-to manual to prepare us for the day-to-day hurdles. With that in mind, Lincoln-Lancaster County Health Department and Cedars Youth Services partnered up for a program called Healthy Families America to give parents a helping hand. Joining me today from that program are Kodi Bonesteel, the program supervisor, and Janel Binder, a home visitor for Healthy Families America. Welcome to Shape of the City. Thank you both for joining me. Tell me, Kodi, a little bit, what is Healthy Families America and how did it get started?
Healthy Families America is a free and voluntary home visitation program that we started offering at Lincoln-Lancaster County Health Department with Cedars in 2008. It originally started as a program in 1992 through an agency called Prevent Child Abuse America after decades of research. So it's really a prevention program for child abuse and neglect. We work with families to establish a positive child and parent bond and work with things like family goal planning and linking families to community resources that they need.
Okay, now who provides the home visits for Healthy Family America?
Yep. We've got 16 full-time home visitors at our program. So we see anywhere between 250 and 300 families at a time. Our home visitors, half are public health nurses and half are community outreach specialists, so more like social workers, but they all do the same role as a home visitor. About half of our home visitors are certified lactation counselors, so they have expertise in breastfeeding. And 4 of our home visitors are either multilingual or bilingual, so that helps a lot when we have families that speak other languages.
Very good. Now, what are some of the positive outcomes you've seen with the program?
Sure, we have a lot of positive outcomes with this, using this model. We have 1.5% of our caseload has a substantiated case of child abuse or neglect, so that's really low. We're really excited about that. Almost all of our moms and babies are linked to a healthcare provider and have health insurance, and over 90% of our moms initiate breastfeeding, which is a huge success for us.
Definitely. Now tell me about a typical client that you might see.
Well, we don't have any typical clients. We serve single moms, we serve married families, grandparents as parents, teen mothers. We have families that speak 15 different languages, so quite a diverse background in the families that we serve. There are no income restrictions for our program, so it's a very diverse group that we serve.
Okay, well, you mentioned income requirements, so what does make a person or a family eligible for this program?
So eligibility for our program, our families need to live in Lincoln or Lancaster County, within the city limits or within the county limits. We typically like to start seeing families when they are pregnant, so during that prenatal period is when we see the most success, but we will see families after birth up to about 3 months postnatal.
Okay. Very good. Now, how do families enroll in this program?
So if anyone is working with a family that they think might be interested in our services, they can call or visit our website. Families can also self-refer. We work with a lot of local agencies and providers, and we have good partnerships with the hospitals, so a lot of our referrals come that way, but anyone can self-refer or refer a family that might be interested.
Okay, very good. Let's talk to Janel for a minute. How often do you see a family once they're enrolled in the program?
Well, initially, the majority of our families, when they enroll in the program, are pregnant, and so we will see them at least 2 times a month. After baby's born, we can move into weekly visits and do that for about 6 months. And after that, we'll kind of start backing down the visits to a couple times a week, maybe even monthly, and then quarterly.
Okay.
That's kind of flexible too. We always decide on what's best for the family as we talk and meet with the family and decide together what's going to work best for them.
Okay, what are some of the activities that take place when you're on one of these home visits?
We do utilize a curriculum. In the curriculum, we have a lot of prenatal activities that we can do with them, many different topics, things that cover safety, child development, parenting, and we also have activities that we can do with them after the baby's born as well. We do ongoing screens with our families. The screens include substance abuse, depression screening, child development screening, and also looking at family violence. We'll do lots of different fun things too. We might bring out some painting activities and other hands-on child development activities we can do with the kids. One of the big things that we do with our families is family goal planning, learning about what the families are wanting to focus on during the times that we work with them, and we'll make goals and focus on those. And then we'll also, we can also do many different things with them in accessing resources, applying for housing, economic assistance, school applications, etc. The biggest thing to remember for our home visits is that not two visits are the same, and they're very flexible. You may have an agenda when you go out to the home, but you might walk into that door and they have some needs that have arose, and we have to focus on that for that day.
Sure. Now, how long would a family typically be involved in the program?
Sure. Typically, we will see families for up to 3 years of age. Now, during that time, they might be looking at attending other early childhood programs, Head Start, preschool, and so they may transition out of the program. We do have the ability to serve children until the age of 5, and many times our families may have new pregnancies while we're seeing them, and so we may extend our services to them, to those other children that are being born too.
Okay. Now, what sort of client feedback have you heard about the program?
We recently just conducted an anonymous client survey, and in that survey, 97% of our clients were either satisfied or very satisfied with our services. And they also reported that they felt that their home visitor was very respectful of their home and their culture. They also reported, about 80% of them, that they felt the services they were receiving had helped them to improve their child development skills, learning more about child health issues, and also just finding more social supports for themselves.
That's great. Now, what do you enjoy most about working with these clients?
I would say that for me, being a home visitor, I love the relationship building piece that I get to form with these families. Every family has their own issues that they're working on, and to be able to get in there and to provide education, to provide support, help them access those resources, so those families are able to succeed is so rewarding and very beneficial to those families.
Very good. All right. Now, Kodi, where can people go to learn more about this program?
So they can visit us on our website for Lincoln-Lancaster County Health Department, or they can give us a call on our referral line, and one of our staff will be able to help them walk through the referral process.
All right, great. Well, thank you both for joining me today.
Thank you.